So there's a book that I've been reading by Dr. Frantz, Fanon, and the book is called Towards the African Revolution. Why was I reading this book? I guess I just wanted to gain some further insight into colonial history. Now, what I didn't expect is for some parts of it to feel disturbingly current. So there's a chapter in this book and it's called the North African Syndrome. By the way, the North African Syndrome isn't a real disease, but it is something that Dr. Fanon exposes in this chapter. So Fanon, for those of you who are unfamiliar with him, he was a psychiatrist who was working in Algeria in the 50s, and he was also a philosopher. So in this chapter, he basically explores how colonial doctors would be dumbfounded with the types of symptoms that some of their patients were presenting with. So some of their patients that they would encounter would describe having pain everywhere. The pain was difficult to localize, it was difficult to pinpoint exactly where, it didn't really neatly fit into descriptions that were found in medical textbooks. Their symptoms were difficult to describe. And so rather than, and this is what Fanon highlights, rather than taking a step back and thinking maybe the medical frameworks that we're using is limited, the patients themselves were seen as being problematic, as being unreliable, lazy, dramatic. So one of the arguments that Fanon is making in this chapter is that things like the North African Syndrome, that says a lot more about the doctors than it does about the patient's pathology/presentation. It says a lot more about their frameworks and assumptions than it does about the patient. Because as human beings, we like dealing with things where we can pinpoint and go, this is where the issue is, and this is how we're going to manage it. Like someone has a broken bone, probably a fracture, and this is how we are going to deal with it. They have a chesty cough, it might be some underlying infection. They're feeling thirsty all the time, passing a lot of urine all the time, fatigued, probably look into whether they're a diabetic. Like we like when things behave in a textbook diagram sort of a way. Whereas not all suffering is going to present in this way. It's not going to present in a way that is visible, measurable, that you can pinpoint the cause and the effect. Fanon also noticed how patients' distress couldn't really be separated from the environment that they were living under. Like as humans, we don't live in a vacuum. And likewise for the patients whose presentations he highlights in this chapter, they couldn't be separated from their environment, the poverty, their living conditions, racism, living under colonialism, displacement, violence, etc. One particular argument or point that Fanon makes in this chapter is that medicine isn't as neutral as we would like to imagine it to be. He points to how medicine can sometimes become complicit in systems of power. Institutions, without them fully realizing, might be absorbing particular stereotypes and assumptions that are prevalent in society. And he points to how colonial medicine, instead of just simply treating illness, would be justifying inequality. It would be pathologizing entire populations and reinforcing particular stereotypes. Reading this chapter, I couldn't help but notice the similarities between some of the symptoms today which we don't really have answers for, our medically unexplained symptoms or conditions / disorders / syndromes which we're beginning to understand, things like fibromyalgia, chronic pain syndrome, although I guess in some ways they're not as widely understood as conditions where you've got a particular lesion that you can point to go, this is where the issue is and this is what the clear-cut management is. But with that being said, I guess in some ways we've come a long way in the past 70, 80 years that Fanon was talking about, because like I said, he was a psychiatrist in the 50s in Algeria. We're now in the 2020s. With functional disorders like fibromyalgia, we now understand that there is a sensitization of the nervous system. Like the body has learned to stay on high alert. Like the volume control when it comes to pain has been turned up as a result of stress, trauma, chronic adversity, poor sleep, repeated strain, etc. And so the nervous system has now adapted in a way that is no longer useful. Now, I'm not saying that the North African syndrome that Fanon was exposing or the functional disorders that we understand today, things like fibromyalgia, I'm not saying that they're identical, but I am saying that it does highlight a particular blind spot, how not only in the medical world, but when as humans we can't physically pinpoint the issue, when it's something that isn't visible, that we can't measure, that we can't pinpoint, it doesn't fit into anything that is in textbooks, we begin to wonder whether this physical issue or this wound actually exists. And we begin to doubt the person who's telling us said issue, said problem. Moving swiftly on towards the end of the chapter, where Fanon is referencing doctors who are moving away from the medical framework of identify the lesion and treat it to broadening their horizons, broadening the framework to have this more holistic overview of the patient. Like, who is this patient seeing in front of me? What conditions are they living under? What stresses, what fears, what insecurities do they have? Their relationships. Just having an overview of who the patient is to better understand the symptoms that they are describing. Because as humans, we don't live in a vacuum. Our bodies don't just respond to microbes and injuries. Our bodies also respond to the conditions that we're forced to live under over time. With that being said, I feel like I've probably missed out on a couple of other points that Fanon highlights in this chapter. But these are my thoughts so far. Let me know what you guys think in the comments.